All right. So my name is Melissa Marts, and I am the Program Development Administrator for the Pikes Peak Area Council of Governments Area Agency on Aging. It's a big mouthful. We are the organization that coordinates the Older American Act dollars for El Paso Park and Teller counties. And what that means is that we get funding from the feds and the state to provide services, usually through partner organizations, some of them are in the room today, to actually provide direct services to older adults. And so we have a little bit of money to help with mental health because of the Older American Act dollars, but we absolutely do not have enough. It's a terrible, terrible lack that we have, and I know that these organizations carry wait lists, and we have significant concerns and issues, and that's why many of us are here today. When I first learned about the State Mental Health Task Force back in July, my organization set up a meeting with Representative Lois Landgraf, who's a great supporter of older adult issues. She came to our office. We talked about the task force, but learned that it really wasn't going to be talking about older adult issues. We were really concerned about suicide prevention, we were concerned about youth, we were concerned about prison transitions, those kinds of things. Older adults, maybe not so much. So we formed a El Paso County Behavioral Health Task Force for older adults, and we've met twice. The goal of our task force is to actually come up with some of the barriers, issues, concerns, new ideas for services, what can we be doing to do more for our older adults. So I appreciate the time today for you guys, knowing that you're going around the state, you're getting these types of testimonies from people and organizations, and I really appreciate that. The State Demographer's Office tells us that by 2030, so that's 10 years from now, 1 in 4 Coloradoans will be over 60 years old. Older adults today, as well as those that come into older age in the next 10 years, are seeking different types of mental health support, and we are looking forward to try to figure that out. Mental health for older adults includes those living independently, in facilities, and most importantly, the caregivers. For the people in this room who have testimonies of how they have cared for their family member, whether they're a young person, middle-aged person, or an older adult, caregivers are pretty quiet and don't ask for help and need it as well. In addition to the increased numbers, there is a significant diversity of need. For those who are independent, they are at risk for a landslide of declining conditions that begins with isolation, poor nutrition, decreasing ability to communicate. One woman I know shared her story with me about how she found herself alone many days. She would have conversations in her own head about how life was going and what was happening. But then when she would come face to face with somebody, because she'd spent so many days alone, it was hard for her to make that connection between what she was thinking in her mind and actually having the words come out of her mouth. Fortunately, she realized she was in trouble, needed some help, and she knew who to ask for help. How many of our older adults have no idea or the energy to even ask for the help? As our culture changes, people need to know where to access help. Providers and funders need to be open to more unique and different supports. Some of them might be home-based. Some of them have already been talked about in terms of more peer support groups, peer programs, and other additional trained facilitators. For those in facilities, there's a group of us that just worked at the state level to address PASAR delays for older adults who are in emergency placement. Due to changes in contracting services and many other issues, our hospitals and long-term care facilities were forced to hold on to individuals, older adults, for much longer periods of time than they needed to. That means that this individual is being, held in a place where they're not getting the right types of supports that they need. The services are costing a lot more money. And for one particular woman, it was over 3 months that she was delayed. Oftentimes these delays will also cause changes in medication status. And when these older adults, and many of them have pretty significant mental health issues, are changed with their medications, again, kind of another landslide of issues comes around. So these folks, again, in the facilities, are at risk, pretty significant risk, because they experience fear and confusion when they have repeated moves. They don't understand what's going on, and it's really frustrating for them, which also means it's frustrating for staff. as Velda shared so well about how the people who are working to help folks, are impacted as well in very significant ways. So when we think about these medication fluctuations, these long-term stays that should not be happening, we are allowing completely unethical care, and it needs to be addressed and looked at. I will say that the state, once it was brought to their attention, there were quite a few meetings, and those PASSAR issues are being addressed. But we have yet to have that meeting where a lot of the folks confirm that those changes have been made. So again, thank you to the state and to the task force for having these opportunities, for ensuring the needs that for older adults, whether they're living independently or in a facility, are considered. For sure, at least for safety net issues that might need to be addressed, but also for the overall state plan that it's inclusive of older adults and their caregivers. Thank you.